Ayubowan, Ellarakum Vanakkam, and hello everyone. So my name is Chamindra Veeravardhana, and I'm a commissioner of the O'Neill Lancet Commission on Racism, Structural Discrimination, and Global Health. And so my discipline is international politics with a core focus on feminist political theory and the politics of deeply divided societies. And on behalf of the Commission, it is my great pleasure to welcome all of you to this event. And so this event is entitled Decolonial Feminism, Public Health, and Indigenous Justice. So this event is organized from the premise that we cannot really have a consistent conversation on global health or public health or any other aspect of healthcare provisioning in the absence of a strong focus on decolonial feminism. And here, by the term decolonial feminism, the adjective decolonial that comes before feminism, what I imply is a critical intersectional feminist perspective. It's a critical intersectional feminist perspective that challenges or critically engages with, rattles, and works towards dismantling oppressive and inherently patriarchal power structures. So indigenous feminist thought coming from Turtle Island, which we know many people know as North America, Aotearoa, New Zealand, or the unceded sovereign territories widely known as Australia, Pacific Islands, and many other places form the center point of decolonial feminist thought. So this critical decolonial feminist conversation on global health, we believe, is essential. And that is hence my decision to convene this vital conversation. So today, to engage in this conversation, I'm joined by a team of excellent panelists, and it is my great pleasure to introduce Professor Chelsea Watego. Chelsea is a prolific writer and public intellectual, and Chelsea is a Munanjali and South Sea Islander woman with over 20 years of experience working within Indigenous health as a health worker and researcher. And Professor Watego is currently Professor of Indigenous Health at the School of Public Health and Social Work at the Queensland University of Technology, situated in the unceded territories of the Turrbal and Yugara people in Mianjin. Professor Watego, it's a great pleasure to have you on this panel. Welcome. And we're also joined by Dr. Tlale Mofokeng, the United Nations Special Reporter on the Right of Everyone to the Enjoyment of the Highest Standards of highest attainable standard of physical and mental health. Dr. Mofokeng is a distinguished medical professional who has built her medical practice with a strong intersectional feminist set of ethics. An abortion service provider, Dr. Mofokeng's medical practice, is widely viewed around the world as, especially in global South countries, as an insightful precedent in how best to practice medicine with a truly feminist ethos. So Dr. Mofokeng also teaches at several institutions, including Fordham University in Lenape, New York, and at Georgetown University in Washington. So Dr. Mofokeng, a very warm welcome to this conversation. So to kickstart today's discussion, I'll start with Professor Watego. So Chelsea, in 2018, you wrote in an article, and I quote, "The necessity of despair." You called it the necessity of despair when seeking funding to provide critical services to our community, as in your community. And I think this is a shared experience among Aboriginal Torres Strait Islander people in the indigenous territories we know as Australia, and also to Te Ao Maori in Aotearoa and in other places indeed. So you further note that, and I also quote, "Each grant application requires us to demonstrate the needs of our community, not our strengths." So the needs of our community have to be demonstrated, not our strengths. "I can't help but be troubled by the utility of despair politically and psychologically for us as Blackfellas." So when we think of systemic racism, misogyny, misogynoir, homophobia, transphobia, and many other forms of discrimination that Indigenous people face when accessing healthcare. How important is it to center decolonial, if not, preferably decolonial feminist perspectives and ways of being and doing things? Over to you, Chelsea.
Thank you. Yeah, look, my public health training had taught me the importance of the evidence base. And over the years, working in the space of Indigenous health as a health worker and as a researcher, I came to realize the violence of that strategy and the violence of the technology of public health, in that the evidence I was required to seek about my own community was all that was wrong with us. And further, even when we showed our needs, it didn't translate to improved services. And in fact, it ran contrary to our goals of self-determination, of being in control, because through our showcasing our needs, our wounds, the state could see us incapable of being in control of our own affairs. And so that knowledge base of needs, that evidence of needs was actually weaponized against us. And, we see this in this current time of, we're currently going through a Senate inquiry into missing and murdered Indigenous women, where the terms of reference seek to count the dead and commemorate them rather than seek justice. And so when we work on this evidence base of needs, we then forget our rights and the assertion of our rights, the assertion of our power, even in our most powerless moments. And so my work now as a scholar and as director of the Corumbra Institute is to centre Black knowing on our terms, and insisting on a Black humanity that doesn't appeal to a Western sense of humanity, but is grounded in our own sense. And I refer to the important scholarship of Dr. Amy Maguire, who's a Darumbal and South Island woman and has studied the phenomena of missing and murdered Indigenous women here. And she refuses the term missing even, and she refers to it as disappeared, because she argues that Indigenous women just don't go missing, they are forcibly disappeared. And she draws on a methodology of presencing, where as a journalist, she tells women's full stories and doesn't reduce them to their wounds, brings to bear their full humanity, because she was able to highlight the way in which the reporting even on missing and murdered Indigenous women is itself violent. And the strategy of appealing to a sense of humanity is a futile one, because we're appealing to those who fail to see us belonging to the category of human to be seen as human. And in that strategy, we're forgetting all the things that make us beautiful and powerful as Black fellas, and seeking constructing a humanity that is configured around whiteness. And so I think there's some really interesting work from female Indigenous scholars here that are refuting the terms of reference from which we are known. And from that, we have a whole different strategy. And our strategy then is not one of appeal, of asking, but insisting. It then gets us configured around justice rather than subservience. And I think that's certainly what excites me in work that is quite painful and traumatic, is that it's far more inspiring. And I think oftentimes we're trapped in this idea of, despair, and that the only solution is hope. And I reject that framing. There are possibilities of living that extend well beyond despair and hope, and in fact remind us of the necessity of fighting and the joy that can be found in our work for justice.
Thank you very much for those thoughts, Chelsea. You shared some very important points there on how evidence is weaponized against Indigenous people. And this is this is a shared reality, right? So you see that in in the indigenous territories we know as Australia, and also in Aotearoa when it comes to Maori health and Maori health authorities and so on. And also this is a shared experience in North America, in Turtle Island. And then you mentioned missing and murdered Indigenous women. And this again is the MMIW, the hashtag is also hashtag known to, unfortunately, to many people in Turtle Island, what we know as Canada, what we know also as the United States, and also in many other places. So full solidarity we express, because we cannot have this conversation on decolonial feminism and global health, or public health for that matter, without expressing our full and unconditional solidarity with the missing and murdered Indigenous women campaigns that take place worldwide. And thank you, Chelsea, also for mentioning Dr. Amy Maguire's work, where she talks about disappeared women, forcibly disappeared women. Actually, I mean that is the correct definition, in fact. So Indigenous women facing like extremely high levels of violence, forced disappearances, are realities, unfortunately, that we notice in many parts of the world, including South Asia. So I'm particularly thinking of Dalit, Bahujan, Adivasi women in the South Asian region, as well in my home region. And so constructing humanity configured around whiteness, Chelsea. I took notes when you spoke. So constructing humanity configured around whiteness is a fundamental tenet, I believe, of the white settler colonial project, because to make that project legitimate as such, you had to construct a sense of humanity around whiteness. So this project is still continuing. And we see that also when we look at the global crises that we face today, from Aotearoa to Palestine. What we notice is a repetition of these fault lines, declaring a land, a highly populated land, terra nullius, and then constructing humanity configured around whiteness. So unless and until we profoundly challenge these realities, it would be very challenging for us to think about feminist approaches to global health. So to the attention of all our guests joining us from different parts of the world, I would at this point like to mention that one of our guest panelists, Debbie Narewa Packer, who is the co-leader of the Maori Party, Te Pāti Maori of Aotearoa, New Zealand, is unable to join us today due to the extremely volatile political situation that Te Ao Maori or Maori people face in Aotearoa, New Zealand today. There are efforts to undo the Te Tiriti o Waitangi, the Treaty of Waitangi, the fundamental text on which the state of Aotearoa, New Zealand stands, and also to dismantle many services and many gains of Maori people in terms of civic rights and health-related rights and the rights of the child, and in many other aspects. So Vaine Maori, Maori women, and Mokopuna Maori children, and Rangatahi Maori youth are particularly affected by these developments taking place in Aotearoa, New Zealand. So on behalf of our commission, I express our full solidarity to Te Ao Maori, to Maori people, and also to especially to Maori women, leading a lot of resistance actions at this point of time in Aotearoa. And we also express our solidarity with Via Debbie, who is unable to be with us today. And we hope to host her at another time on behalf of this commission. So on that note, I will move on to Dr. Mofokeng. Dr. Mofokeng, it's a great pleasure to have you in this panel. And so I will start with a question that kind of cuts to the chase. When we think of your own medical practice, when we think about the practices of medicine, how would you define the terms, feminist medicine or feminist public health or feminist global health for that matter? So what are your thoughts on whether or not the global health sector is ready for, feminist perspectives? Because from what I have seen from a distance is that it seems to be a bit, reluctant to consider critical intersectional feminist perspectives, many platforms on global health. So as a medical practitioner and as the United Nations Special Procedures Mandate holder on the right to health, what are your thoughts on these issues?
Thank you very much, Shamindra, for having me. And it's a pleasure to also see Chelsea again and to share some space with the two of you. And I firstly want to say that I knew already going into medical school that I would have to relearn possibly a lot of what I was going to be taught, because I knew going into medical school that it was still a miracle that, people like me made it in that system. But I also knew that part of the pedagogy and the history of medicine was also filled with racism and sexism as well. And also the ways in which medicine itself was being taught to me in content and in methods was not preparing me for the real world out there. And I found it to be firstly disempowering for me as a medical doctor, who had to assume this godlike figure, who had all the knowledge, who was all knowing, and could make and take particular decisions on behalf of people. And one thing that had always bothered me is the extent to which, medical practitioners can label people things. And one of them, is being non-adherent to treatment. And a lot of the reasons why people were labeled non-adherent to treatment was because we just assumed, for example, if we said take medicine 3 times a day with food, that people had access to food 3 times a day to take the medicine with. And when they didn't finish the antibiotic, we would be judging them for why they didn't finish the course and why they are still sick. And so you can see then why some of these underlying determinants of health were then both racialized but also gendered. And they were impacting, of course, women very differently as well, because women were seeking health much more within, formal health systems. And going back to your question, one of the reasons why I ended up working in sexual and reproductive health is because one thing again that did, I found very disempowering is this idea that the autonomy of women, and especially feminine and queer people, lay outside of them. The state and everyone else laid claim to that autonomy and self-determination and had rules and has cast nets in terms of limitations of what that exercise of autonomy could look like. And so then that informed sort of my understanding then of what these socially constructed hierarchies meant. So how racism then, morphs into class and then into sexuality, into ability, and how then under these systems of capitalism and neoliberalism, and all of those compounded and looked differently, because they really then spoke about power and how power moves and how power shifts. And so to get to a decolonial feminist medical practice, one then has to understand power, but also interrogate power and actually interrogate oneself to get rid of that power and that hierarchy that unduly gets given to you because you are a doctor, right? So you kind of have to unlearn medicine and unlearn and almost reject in a way, right? The medical fraternity and the learned ways of being, if you truly want to be a decolonial feminist who is committed to a medical practice that centers, therefore, then a protection and promotion of the autonomy of people, but also the creation of the environment conducive for those people to then to truly self-determine. Because it's also one thing to be able to make a particular choice. But we know that we live in systems where the ability to make a choice is simply not enough. You need to have systems, social systems that are therefore designed to create an opportunity that's equitable for the outcome of positive health outcomes. And so what autonomy looks like, what self-determination looks like, what a dignified looks like, those are very subjective things. And so therefore it forces us, like Chelsea was saying, to ask very different questions. What does dignity look like to you, as opposed to what disease bothers you, or what kind of ill health or illness, right? Or what is wrong, what is missing. So we are no longer working from a space of lack or a place of pathology. We are now working from a place of, to what extent and what kind of support do you require to really fully realize the true version of yourself? And for me, that's what's been powerful then about understanding what feminism and intersectional, but also Black feminist theory is, and also locating it within my own medical practice as someone who is a Black woman, who is a childhood survivor of apartheid in South Africa, and resisting the urge to fall into the trap and being sucked in and being seduced by the power of what being a medical doctor brought and what it meant. Thank you.
Thank you, Dr. Mofokeng, for those very, very important and very critical perspectives that you shared. And it is very important that you took time to share your own route or your own parcours into the medical profession, and going into medical school as a Black woman, as a young Black woman, because you're walking into a sector where misogynoir is something that has a long history of being institutionalized, right? From the days of Marion Sims and his supposed gynecological innovations practiced on the bodies of Black women. So the legacy of these historic injustices towards Black women continue to remain. And I have had friends in my personal circle, Black women, who have had major challenges in explaining their health concerns to medical staff in contexts of hospitals, and especially in Western contexts, where the pain suffered by a Black woman is very often denied, very often disregarded. And those realities, the legacy of misogynoir in medicine is alive and well. So hence the vital importance of the work that we collectively engage in this commission. So you mentioned, Dr. Mofokeng, autonomy, self-determination, and dignified treatment in healthcare. These are subjective things, absolutely. And when it comes to autonomy or self-determination in Te Reo Maori, in the Maori language, there's a beautiful term, mana motuhake, for self-determination. So very often when it comes to sexual and reproductive health, self-determination or the right to bodily autonomy is the first thing that the system tries to take away from us and completely disregard. So in that context, I very much appreciate the points you shared, and we will be able to delve into those points a bit deeper later on in the discussion. So Chelsea, at this point, I will come to you. And this is a continuation of this conversation with Dr. Mofokeng. So you have written about the necessity of Black bioethics, and I quote, premised upon an unconditional love of the Black body. And that's a very beautiful way of putting it. So an unconditional love of the Black body. So and it's a 2021 publication. We'll link these publications when the recording of this event is published on the Commission's social media channel, especially the YouTube channel. So Chelsea, can you please share some thoughts about the importance of centering Black bodies, especially Black women in all their diversities and gender diverse peoples, when rethinking healthcare policies that are for, by, and of Indigenous people? So I just to also quickly add that this question is very relevant to the territories we know as Australia, because what was very much a Black continent is what they declared terra nullius, right? So that in the backdrop of that historic injustice and its continuing ramifications, it is in that context that I raised this question about, your thoughts on the importance of centering Black bodies and Black women in all their diversities when rethinking healthcare. Over to you, Chelsea.
Thank you. That paper, I just want to give context, was written out of love for a dear friend, family member's daughter, who had tragically taken her own life, and whose story would be told by a well-meaning white doctor as the impetus for him getting his latest research fellowship. The mother of that child worked within his team, and he never had a conversation with her about this, but he extracted her story of pain and trauma to rationalize the investment in his research career. When I speak about a love for Black bodies, it's not a metaphor. I sat with that mother and her child that morning, and I don't think people fully appreciate the way in which Black death is big business for the health system. I think we often think about the violence of the state as perpetrated by police, but the health system often gets a free pass. And here in this country, we're looking at, I've shifted my energies to surveying my people to count all of the poor health behaviours, to buy into that story of non-compliance as an explanation for the racialised health disparities that we experience. Instead, I'm interested in the ways in which the system produces these that make these differences seem natural and inevitable. Here in so-called Australia, we haven't had our post-colonial moment. So I don't speak about decolonizing necessarily. My position is an anti-colonial position, recognizing that's an ongoing stance that we have to take against the state and all of its institutions, including the one I was disciplined by. So it means making oneself an enemy of the state, an enemy of colleagues that you've worked with, who are still performing to the same business model. We have to understand the violence of the health behaviourist approach. And I think, it was promising when we saw the social determinants of health take more prominence in public health. But unfortunately, the epidemiologists have monopolised our understanding of the social determinants of health with these ridiculous flowcharts that have things like race and class as separate categories that always are filtered down to an individual health behaviourist approach. That because of my racialised and gendered location, I'm more likely to smoke or more likely to be less educated and therefore make poor health choices and therefore be non-compliant. And so we have to recognise the way in which racialised and gendered violence is enacted in every aspect of our society, not just from the stranger on the street, the white male perpetrator who operates with a culture of impunity, knowing that the violence he visits he'll never be held accountable for, but to the violence of the systems that claim benevolence, that work upon us in all kinds of sadistic ways, and the way in which we become complicit in them in sustaining those things. I think about, here in the settler colony, the chief medical officer could also be the chief protector of Aborigines. So public health has always operated as an apparatus of colonial control. It was in my grandmother's generation that the Queensland Department of Health, in their reports on STIs in the 1930s, would have the derogatory term gin as a source of contamination category. So here, Aboriginal women were to blame for the spread of sexually transmissible diseases at a time where it was well known that Aboriginal women were under the Protection Act in Queensland, and were sent out to work on properties and were subjected to widespread sexual exploitation at the hands of white pastoralists in this country. But we were the source of the spread. And so when we look at this current time with, say, 100 years ago, the mechanisms are still the same. There's a different language that is used that makes it seem less racist, less violent, but you scratch beneath the surface and you see how this plays out. I mean, in health, we surveil and regulate Black women's bodies, much like the police. Indigenous women here are the fastest growing prison population. So we are constantly under the gaze, and I think it is unethical for us to continue to be of service to such institutions in this way. And unfortunately, there is so much Indigenous health research that meets ethical guidelines, but is perpetuating this form of violence upon Indigenous women, producing the knowledges that make the outcomes we experience seem all of our making, all of our imagining. And I think what's inspiring to me, though, is the ways in which Indigenous women, despite the violence we experience, are on the front line in the resistance against it.
Thank you, Chelsea. Thank you for the thoughts you shared. Quite heavy material, thoughts and content, but necessary discussion. So in the sector of public health now, when you look at conversations that take place about government policy on public health, for example, be it in Australia or in Canada or in other settler colonies, very often there is a tendency to ignore the politics at interplay, the politics of colonial oppression, and the tendency to act with a sense of historical amnesia, and also an amnesia towards the ongoing forms of colonialist violence. This challenge in this way of doing things is, I guess, a major challenge. And Chelsea, you rightly mentioned also the how these mechanisms of oppression are still the same, are still in place now in Turtle Island, or in the territories we know as Canada. The residential school system, right, which was created to destroy Indigenous communities, and also in so doing to destroy very in some cases matrilineal cultures and gender diversities, and a lot of vibrance in those communities, destroy languages and forms of knowledge generation, and that linguistic cultural genocide continues in the form of the foster care system. The last residential school may have closed its doors in 1996, but the system continues. The system is still in place. So when we think of Aotearoa through Oranga Tamariki, similar forms of exploitation of Maori babies is still in place. And So when we also think of, Chelsea, you mentioned women in prisons, that ratio, I believe, is similar in Aotearoa, and it's a very considerable percentage in Canada as well. So what I'm trying to the point I'm trying to make is the importance of our viewers taking stock of the shared nature of these challenges. So it's like a mirror effect. So you see these things in the white settler colony in many forms. And also when you think of colonial control, right? Colonial control, now this connects to our earlier discussion on misogynoir, control over Black women's bodies. There is a long history, a very violent history in the Réunion Island, which is still a part of France on the Indian Ocean, l'île de la Réunion, in the Réunion Island, of Black women being subjected to forced non-consensual sterilization. And so these legacies are what we are left with when we think of the sector of public health and for that matter global health. So it is crucial that we continue our battles against this tide of colonialism, the intersections of colonialism, racism, misogynoir, and to which the transphobia, intersex phobia, all of that is also an integral part of these shared oppressions. And more power to you, Chelsea, with the work that you do. And at this point, Dr. Mofokeng, I'm moving over to you. And in an interview you gave a few years ago, you made a very interesting point, and I'll read it out. I'm quoting you here. You said that, and I quote, "Racism is not a phenomenon that's just located in one geographical area or region in the world. Racism is a tool to advance imperialism. If you look at India and the caste-based discrimination and colorism, that's all a function of racism. And the color of your skin in many areas around the world was, and even now is, something that was used to gauge proximity to whiteness. Even in spaces where the majority of the population are not white people, there is anti-Blackness." So there is a lot here. And the key point that I wanted to bring forth, and I would like to ask you to share some thoughts about, is the shared nature of racism, and especially in the sector of how that shared reality of racism manifests in global health, in terms of your own country visits, in terms of your international engagements as the special procedures mandate holder on the health portfolio. How do you see ways in which, how can we perceive ways in which we can work towards challenging these shared realities of racism? Because now when you think of caste, for instance, right, caste travels far and wide. So caste-related discrimination in healthcare provisioning occurs not only in India, it happens in Canada, it happens in South Africa, and happens in many other places as well. So what kind of strategies can we come up with in terms of sharing awareness on these issues and in challenging these realities? Over to you.
Thank you, Shamindra. So I've been reading a lot and listening a lot to Black women poets, because I must be honest that I have been quite exhausted myself, in the past few weeks, months now, with this genocide going on in the occupied Palestinian territory. And I think it's important to recognize how incredibly difficult the price is, right, for doing this work at the pace at which we do it, and at the level of influence and of power at which we do it at. And it's by design, right, that we feel so incredibly depleted, and I can speak for myself. And I think the danger then is that when you fail to get things done, you fail to meet your target, you fail to get a ceasefire in Gaza, you fail to protect intersex persons from unnecessary medical procedures, or you fail from having really harmful people in positions of influence and authority, churning out transphobic work, work that's anti-sex workers' rights. You tend to sometimes think that those are a reflection of your own individual commitment, right? That those things are failures because you didn't try hard enough, without realizing that, in fact, by design, imperialism and racism are meant to tire all of us out in the process of fighting it. And that's why the strategies and the cross-movement building has been so key for me in my own activism, but in my own advocacy and thinking about it long term. And it's only through really realizing that coloniality, through racism and this inferiority that it demands of everybody, right? It uses violence and it weaponizes and dehumanizes in the process, that it implants a deep sense of self-loathing and a hopelessness, and that it's in the resistance that we demand through the work we do, and which is how, even with the commission, I always say the process of doing this work in the commission is as important as the report and the recommendations we'll come up with, because it's in that process that we need to humanize ourselves again, that we need to give ourselves the kindness and the grace again that have been stripped away from us, right? And so this idea of Black love and Black joy as resistance are fueled by that it's actually by showing up in these spaces that were not designed for you, even though you are a piece of the puzzle that doesn't fit. You should be happy that you don't fit, because why would you want to fit in these systems that were created for dominance, for violence, and for complete destruction? And so for me, if I ever walk into any room anywhere, including the United Nations, and I feel comfortable and I fit in well, I know there's a problem. I know there's a problem. So for me, I move with that feeling of unease, and that I should not fit into these systems, right? And so that rage and that fury that I carry with me reminds me always why I got angry. So when I get to the top floor, I'm not happy that I got to the top floor. I do the work of what got that made me an angry Black woman on the third floor as I was progressing in my career. So when I get to the top floor, I can flip that table. There's a certain level of audacity that we also need to be able to do this work, right? So it's always about loving each other through it all, through it all. Because often that's all we have to give for each other. That's all we have to give to each other, right? It's grace and love. Because if you are trying to dismantle systems that reward certain things, we have to find other ways of showing up as our true selves for each other so that we can co-create and co-vision. And we can't do that if we have that deep sense of self-loathing, because that's where anti-Blackness comes in, right? And that deep sense of I'm inferior just because I'm Black or just because I'm an Indigenous woman from a particular community. And if we can get rid of that, but also realize that the systems everywhere are designed to keep us thinking we are inferior, we will, I think, move forward with resistance, with persistence, with insistence for our own dignity and our own thriving, because I think a lot of the times we are stuck in survival, and for good reason. We are stuck in survival for a good reason. But today we're voting in South Africa, and I was just reflecting that I'm tired of freedom, the sense of freedom and the sense of who I am as a Black person, the very essence of who I am. I'm tired of that being some promise for me in the future. I want that to be my present. I want to experience that in the present. I'm tired of it being a perpetual future that never comes. So that for me is what partly drives me and sort of my outlook in life, and why this work is important, to do the inner work as well, the evolutionary work, as much as we do the revolutionary work out there. It's important to do the personal work as well. And it will take community love to be able to do that and to be able to be held in those moments where you also need time out, because that's why we get tired as activists, because we work ourselves to the bone and we feel like if you take a break, you're letting the whole movement down. But if we cross-build, if we cross-mobilize, then I know that if I'm not in the room, I know that my issues will be on the table, because you too, as brilliant women that you are, will do the same. I don't have to be in every room and every table. And I think that for me is what's important, is how do we create community love and community resistance across all of these movements and across geographical spaces as well.
Thank you very much, Dr. Mofokeng, for those thoughts. It felt like a masterclass in Black feminism, actually, because when you think of the key points you mentioned, right? The necessity of kindness and grace, and navigating these sectors with with the focus on creating a community of love and care. It reminded me of the Combahee River Collective of the 1970s, a Black lesbian feminist collective led by a group of fantastic Black feminist leaders. Some of them still very active in Black feminist circles in Turtle Island, including Dr. Barbara Smith. And Dr. Smith has repeatedly said in her public appearances something along the lines of, you cannot be miserable in your activism. And this is also echoed in a lot of public pronouncements of the late Dr. Bell Hooks, that you have to find some form of joy in your advocacy work, in your activism, in your academic innovations, when you fight epistemic injustices and so on. And so it's a Black feminist principle, to put it that way, that this importance of finding joy and creating communities of care, creating communities of love as we walk this long journey. So what you mentioned about the situation in Palestine and pressing challenges elsewhere as well, in the Sudan, in the Congo, and in many other deeply divided places across the world. The by design, you rightly said, that imperialism and racism are meant to tire us out. So that's the age-old strategy of divide and rule, right? Which still stands, which still prevails. And so this kind of tendency of the imperial core to tire us out, to lead us to a place of self-loathing. It is also visible, I think, in the non-profit industrial complex as well, in the philanthropic sector, in the non-profit sector. For example, people tend to work in silos. When you say SRHR, that's one sector, and there is a certain number of issues you tend to address in that sector. When you say intersex human rights, that's another sector, and a certain number of rights issues are addressed in that sector. Same goes for trans human rights and other aspects of rights. But what we often tend to neglect is the fact that how interconnected, these bodies of rights are, and how important it is for us to figure out ways in which we can uh, build upon the intersections of where these bodies of rights intersect or connect. So that's one point. And then the other point, that you mentioned with regards to anger as a, as a tool in this body of work, right? Carrying your anger and turning it into a certain level of audacity to open doors and to advocate for change, but in so doing, loving each other, going from a place of love. So I would also like to remind to our viewers another very important concept of Black feminism. That is the fact that this work that we do, this collective work that we do in our respective sectors, in decolonial feminism, global health, these interconnected areas, in anti-oppression work, abolitionist work, all of this is long-term work. So some of the results of our ongoing actions, we may not unfortunately see the consequences, the results of our work within our lifetimes. So hence the importance of looking at this work as a process. So be it knowledge generation or creating precedents, the kind of work that we do in this Lancet Commission, or the work that we do in other sectors, the work that Professor Watego does in the local context in Mianjin and elsewhere in Australia, the work that Dr. Mofokeng does at the United Nations, the work that I get to do in some of my engagements in deeply divided places in Ulster, in Sri Lanka, and elsewhere. These are bodies of work that require continuity. So training the next generation of leaders is a very important priority for us, and ensuring that there are people who will, the way Dr. Mofokeng rightly said, that this is a shared struggle, right? This is not one centered on careerism as such. We don't need to be present in the same room all the time or be in every room. We create the kind of leadership that will be present hopefully in every room, and advocate for the rights issues, the priorities that matter to us, those shared priorities. So training the next generation of leadership and creating that community of love and resistance is an absolute priority. So at this point in our conversation, we're coming towards the end of our conversation. Professor Watego, I'll come to you. When you think of decolonial feminism, and I can see the Indigenous flag behind you as well on the beautiful, wall with a tapestry of a lot of things. When you think of the present day challenges in your local context, shared challenges in neighboring Aotearoa and in the Pacific Islands, and I'm also particularly thinking of what's happening in Kanaki, in Polynésie Française, so-called Polynésie Française at the moment. What can you say about the importance of sharing decolonial feminist knowledge and solidarity, with people, with our people as such, with oppressed people in these regions?
Yeah, look, just to continue on from that previous conversation about leadership, I guess what I like to think about is ancestorship and what does it mean to be a good ancestor in this moment, and what can we learn from each other and each other's ancestors, and how to be a good ancestor locally and globally. We're learning from the Palestinian people what it is to live in a world that wishes you dead, and to insist on freedom. We here in so-called Australia, we say always was, always will be, and there are such connections from the river to the sea. And across the globe, Indigenous peoples have been insisting on freedom and living it, not as an aspiration, but in these moments. And I just think about Palestinian children dancing on streets in the midst of this genocide, who are teaching us about that, insisting on living now. In the midst of the pain of all of this is the power of a people who refuse to die out. And certainly I draw strength from that stubborn insistence. I enjoy being an ancestor that's obnoxious and entitled, that is cheeky, that is stubborn, that refuses to die out and sees that our very existence is our resistance as a people. So for me, I think that's we're caught between living and fighting, and centering love in the midst of that challenge of the living that's bound up in fighting. For me, it's about also about building. So when I came to realize that there was no appeal that would suddenly get them to see our humanity. I mean, you have to wonder in this moment, how big does the death count have to be for the world to care? As the numbers keep going up and up. And so for me, what in this place where we continue to report on the numbers of deaths in custody, the numbers of incarceration or suicide rates, and still it falls on deaf ears, I've been more interested in what do we build as ancestors? What do we build that we leave for those that come behind us, and create those spaces to the infrastructure for building an army for an ongoing fight that's never going to end, but to make it easier, and an infrastructure that provides a home for those who have always been kept at the margins. So for me, that has meant building a not-for-profit in my own community here in Inala, which for 20 years hasn't received operational funding, but we exist nonetheless, and we provide important services to our community. We welcome our babies to country. We introduce our young people into the community as they enter into adulthood. We are there to support funerals and wakes when our loved ones passed. We build that infrastructure despite the state not seeing it worthy of resourcing. And we employ our local people to work in our own community, a community that's seen as very poor, of which rich people drive into our neighbourhood and park in our streets and work in the social services that are meant to work on us but never seem to get us out of our impoverished state. So we exist anyway. We've built the Institute for Collaborative Race Research, where I think we do our most important intellectual work to help inform legal cases against the state. We don't get funding for that. We exist anyway. We made it happen. And that came out of our own institution not supporting us to take on work around racial violence is perpetrated by the state. So we just built it anyway. And what we're trying to, I guess, for me as an ancestor, is showing those that the joy that can be found at the margins, the joy that can be found at the fight, but we have a responsibility to try and build an infrastructure that makes that a little bit easier for those that come after us. You know, I've come through the academy, and unfortunately, a lot of our ancestors have made it easier for us to come through. And the challenge that I find in terms of building an army of our people is the state will offer all kinds of incentives and rewards for our people to just accept things the way they are. And will demonize those who insist on telling a truth about this place. Our intellectual work will be deemed political and radical, not rational. Will be demonized, will be cast as uncollegial. And as an Aboriginal woman, I know what it is to be deemed unloving, unlovable, ungrievable, undeserving of protection. But it's because of that has shaped then what kind of ancestor I am in terms of the infrastructure that we built and the spaces that we create that don't reproduce the violent systems that have been visited upon us, reproduce hierarchies in which we force our people to climb as opposed to abolish. You know, what's centering some of our work, or what's centering much of our work really, is this question of what is it to be human without hierarchy? And it's a question we ask ourselves in all the things we do and build, and all the places that we gather, to remember what it is to be human on our terms and act accordingly, rather than appealing to benevolence of a people that just isn't there. And that's the loving part, is that when we believe ourselves worthy of fighting for, when we believe that we're enough right now, and that no external validation will necessarily give us the love that we're seeking. We have to give it to ourselves. And when we act with that love, there's all kinds of amazing things that we can build that have not been imagined yet. And I think that's the thing that excites me in the midst of the work that we're involved in, and, you know, coronial inquests and dealing with death, is what do we do differently in spite of it all? Yeah.
Thank you very much, Professor Wadigo, for those comments. And you said something very, very beautiful. You said what it means to be human on our own terms. And I will definitely quote you on that one, what it means to be human on our own terms. And when we challenge epistemic injustices in the academy, outside the academy, injustices in the global health sector, especially injustices that women face in all our diversities, trans and intersex people face, and people of many other marginal intersections face this term, you know, what you just said, you know, what it means to be human on our terms. It's a fundamental, very important term, one very important perspective of looking at things. And also, Chelsea, you mentioned something very important about ancestors. And at this point, you know, I'm reminded of Professor Ruha Benjamin, who is a professor of African American Studies at Princeton University, Spelman alumna, and Professor Benjamin recently delivered a graduation speech at Spelman, where she was conferred an honorary doctorate. And that's a beautiful, beautiful speech. We will link the speech to this recording when this webinar is published in the Commission's social media channels. And Professor Benjamin says in that speech that we too will one day be seen as the ancestors, 100 years from now or 150 years from now, that we too will be gathering at the Sisters Chapel at Spelman College. Like there will be people who gathering at the Sisters Chapel who will look at our legacy, and who will look up to what we did today when they look at the work of their ancestors. So in Te Ao Maori, in the Maori world, for example, the work of the Tupuna Maori, the Maori ancestors, is very important, and it is something that Maori leaders regularly affirm, that the work of the ancestors is a guiding light in continuing today's work. So on that note, Dr. Mofokeng, I'll come to you for a final word. And in framing this, I will go back to something you mentioned at the beginning of this conversation about growing up in apartheid South Africa. And you have mentioned these realities, of growing up in a deeply divided society along like violent racial fault lines with a lot of violence around you. And when you grow up in a place of that nature, there is a certain tendency to normalize the violence we experience on a daily basis. Now, I grew up in the 1990s in wartime Sri Lanka, but I come from a Sinhalese background, and I grew up in the central highlands of Sri Lanka. So I did not face the flak of the military offensives face to face. I did not come face to face with it the way people in northern and eastern Sri Lanka did, the Tamil people did in particular. However, there is this tendency in deeply divided societies, in contexts of conflict, to normalize violence. So in news, when in the 1990s in Sri Lanka, when they would say, oh, today there has been an X number of deaths reported or X number of casualties, people would be somewhat desensitized to that reality, that violence, the violence of death. And we see this happening in many parts of the world when violence strikes. And in certain Western contexts, for example, people kind of consciously or unconsciously tend to normalize the high levels of violence around us. So the same way the limits of Western liberalism have been laid bare by the ongoing continuation of the Nakba in Palestine, we also see people coming to terms with violence around us. It may not be at our doorstep, it may not be in our neighborhood, but it is definitely within reach, right? Within a 6-7 hour flight from wherever we are, or a bit longer flight. There is such high levels of violence taking place, murder taking place, death taking place. And today we live in a context where, as a conflict studies scholar, I feel that there is a in the midst of all this darkness, there is one silver lining where people are getting sensitized to violence. That's why, hence the protests, hence the widespread protests happening around the world, and people increasingly being conscious of what's going on in Palestine, and also increasingly in the Congo, in the Sudan, and so on. So in terms of being conscious of this shared, legacy and continuing realities of violence, and how best we deal with it, and how best we process this very volatile security situation, this genocidal development, these genocidal developments in Palestine and in other places as well. Let's not forget the Congo and Sudan. What would be your message to our viewers and listeners on how to not let, how to prevent, the normalization of violence, and how best to take stock of this violence and take whatever collective action it is that we can take? Any perspectives you would like to share?
Oh, that's a tough one. I think I want perhaps to start by saying that, you know, I think the human brain and the heart has the capacity it has. And for many months now, just going through the world and experiencing everything in the world, and then having to respond, in the formal ways in which one does when you are a human rights defender, with the proximity that one has in those UN corridors. There's a certain level of responsibility that one carries with them. But I know that my own heart and my own brain was completely super saturated at capacity to try and find an understanding of how we can fail to prevent what we saw coming, right? Because a lot of what you are talking about and the violence that you are talking about, it's not like violence that just precipitated somewhere overnight. It is violence that was planned, that has been funded, that has been meticulously enacted upon a certain people because of their race or class or because of where they come from, right? And so I've been struggling to understand what to do with all of this myself, because a lot of the trauma that I thought I had processed as a child, as a teenager, was done. And then having to experience this genocide and almost foresee where we would be already in October, where we are now, and find that no one wants to hear that, right? No one wants to hear that there is a deep sense of responsibility to prevent what is happening now. This is not an inevitable part of life, what is happening, whether it's Sudan, like you were saying, whether it's Haiti, right? Whether it's Syria, whether it's Gaza, none of this is inevitable part of a human experience. You have people making choices day after day after day that lead us down these paths. And so I've been incredibly disappointed and full of rage at the level of, at the facade, I think, of diplomacy and the level at which diplomatic speak is protected and performed more than justice and speaking truth to power. James Baldwin said something that all the Western nations are caught in a lie, and the lie of their pretended humanism. And he went on to say that this means that their history has no moral justification and that the West has no moral authority. And I think that has really been what has summed up, the last months and how things have escalated. And it's also, for me, speaks to this, how all of us were pleading to the very people who we thought had some morals to guide them. You can't make a moral appeal to someone who has none. You have to have morals if I must appeal to them. And we are making appeals for humanity's sake to people who themselves are dehumanized. The kinds of atrocities that are reported are not even half of the atrocities that are going on. And to be able, as a human being, to enact those kinds of things on other people, there must be something terribly wrong. And so for me, part of this is to reject the notion that human beings and what these other human beings are doing because of political ideology is inevitable. And so part of what you were saying about how do we move on, and Toni Morrison speaks about survival and trauma, and there was an interview where she did where someone asked her a question about, how to survive and find meaning in the world where everyone is a victim of something. And I find this very interesting, this idea that everyone is a victim of something, so everyone get over yourself. But I think what's important is that imperialism and white supremacy, and therefore all of the isms that then serve imperialism, so sexism, transphobia, all of those, ableism, are the way they are because of a set of people thinking that they are inherently dominant and that others are inferior. And no one is saying no one has no problems, or that we are saying now all Indigenous people everywhere and all Black people everywhere must just have a free pass at everything. But what we are saying is that the certain challenges that we face in life are particularly because of white imperialism and because of white supremacy. And those have a particular meaning for us as we navigate life. And so Toni Morrison goes on, which is something quite beautiful because she speaks about trauma and survival in this way. And I'll share this because it's something that I find kind of helps me a lot, is that survival is not merely about being whole. It's rather about being fearless and behaving beautifully in the face of impossible circumstances. Because she says, being violent is a performance, it's stupid, it's silly, it needs all the violence and the gory and the blood. But she says being good is more complex and it's more compelling than being evil. And she emphasized the importance of finding something interesting and respectful to do in the time between birth and death, and making survival and endurance more fascinating and spiritually fulfilling. Now, you can't make survival and endurance more fascinating and spiritually fulfilling as an individual. So it gets back to that community. So for me, mental health, physical health, and well-being has been important to try and not get so desensitized by what I've had to deal with and respond to in all of these different conflicts around the world, and remind myself that it's actually by being in this way, by choosing good every day, that makes me a more complex and compelling and a beautiful individual, even in the face of what looks like evil. And I think that's what helps. And I think for all of us, it's to go and be in those spaces and draw from what will help us. Because in the face of absolute despair, which I find myself in a lot these days, I'm not sure what else I can offer, but those kinds of understandings, because and again, James Baldwin talks about, you think that your problems are the biggest problems until you read and you realize that actually there's people who had like real problems, and I think that's what for me this time has been about. It's about rediscovering what the people who have walked before me have meant. And I think that's why ancestry is so good. So I've gone back to texts of Winnie Mandela, for example. I've reconnected back to the stories, right, of my own ancestry, which I have found completely fascinating to hear about all of those different things. And so for me, that's what it looks like. For other people, it may look different. But I can tell you that I think the desensitization, it's simply because we just, our human bodies and minds and hearts just simply do not have capacity to process in real time everything that we are seeing a genocide captured in real time, in the detail that it's being captured, and then being gaslighted by the entire system that what we are seeing is in fact not what it's almost like we're in parallel universe, like, oh, oopsie, we just dropped a whole bomb on a refugee camp, on internally displaced people. oh, sorry, we made a grave mistake. Like, you don't just make a grave mistake and then throw those precision military arsenal and kill that many, like it's almost like we are being made to believe that what we're seeing is not even reality. And so there's a lot happening. And so for me, the spirituality part of what Toni Morrison said is very important, because a lot of what we just try so much to intellectualize, it's things we must feel. And because we are scientists, we are experts, we are this, we are that, we don't want to feel. But that's where the truth lies. That's where that's where that's where the essence of our humanity lies. And so I think we ought to spend less time trying to intellectualize a lot and feel a bit more and trust that our gut knows, but also remember the trauma lives in our bones, it lives in our DNA, and the body keeps scores, eh? So part of that listening and feeling is going to require, again, a lot of community love, because we're going to go through some things, but we have to go through them. There's no other way but through. Yeah.
Thank you very much, Dr. Mofokeng, for those very, very thoughtful words. A lot of food for thought shared during this event today. So we are coming to the end of our event. And Dr. Mofokeng, you mentioned ancestors, you mentioned James Baldwin, and that you're reading Mama Winnie's texts again. And on that note, I would also mention one line from Sister Outsider from Dr. Audre Lorde. That's where she says that this is very important to people working in our guests who work in the sector of intersectional feminism, feminist organizing, and SRHR work, SOGS rights work, Indigenous justice work, and so on. And at one point, Dr. Audre Lorde says, I am not free while any other woman is unfree, even when her shackles are very different from my own. So, in other words, if there is a Palestinian woman struggling to feed her babies or access menstrual products or access basic safety, basic human dignity, I may not be affected by the same challenges at this point of time. I may be in another context, but her problems become automatically my problems. And that enables me to build a sense of solidarity, unconditional solidarity. So that kind of solidarity is extremely very important in the times that we live in. And I think Professor Watego and Dr. Mofokeng, everything you shared kind of points at that direction, the importance of building that kind of solidarity and networks and of love, care, and resistance. So on that note, dear guests, I would say that creating space for those with lesser levels of privilege, and especially those who do not have a seat at the table, Black women, Indigenous women, women from migrant backgrounds, queer women, intersex people, and people of many other multiple intersections of lived experience. This kind of work imperatively requires conversations on decolonial feminism, or preferably in the plural, decolonial feminisms. And so we really hope that this conversation today serves as a precedent to many more conversations to come on decolonial feminism in the context of this Lancet Commission, in other sectors, in other collectives that advocate for global health and also Indigenous justice. And that this conversation would serve as a precedent. So thank you very much, Professor Watego and Dr. Mofokeng, for being part of this conversation. I'm most grateful. It's been a great pleasure, privilege, and honor to share space with you. And I also thank our colleagues at the Secretariat of the O'Neill Lancet Commission on Racism, Structural Discrimination, and Global Health at the O'Neill Institute for their tireless work in putting this together. And also, as we conclude, let's affirm that we stand unconditionally from the river to the sea. May Palestine stand tall and free. And also thinking about our fellow panelist via Debbie Nareva Packer, who is a very highly respected Waine Maori, highly respected leader in Te Ao Maori in Aotearoa. The circumstances in which she was not she was unable to join us today are caused by what one of her colleagues in Parliament recently referred to as the extermination, as the ongoing extermination of Maori. So in that context, we would also link a few hashtags that are widely shared in Maori resistance initiatives at the moment: Toitute Tiriti, Toitute Mana Motuhake, and Toitute Ao Maori. And on that note, until we meet again another time at another event hosted by this commission, thank you. Ayubowan, Nandri Vanakkam.